Hey, I thought I'd sit here in the sunshine. How gorgeous is this? I hope you can see me. We get so many women. I've got two just so far this morning that have messaged us who are feeling pretty low, pretty desperate to improve their symptoms. They're diagnosed with either rectus diastasis, prolapse, pelvic floor weakness. Maybe they're going through the menopause and it's taking its toll on their pelvic health. They ask, when we start talking to them about what we do, and that the core foundation of what we do is hypopressives. The first thing people want to know is what is hypopressives. It's been around since the 1980s and it was developed by a physiotherapist in Belgium. So it is physiotherapy created. There isn't a lot of research in English. A lot of the research and the studies that have been done to tell you about how great it is are in Spanish. But we can tell you that we get some great results from it. It's all about intra-abdominal pressure, posture, breathing, and just putting those together. So that's the foundation. We teach you how to lift as you breathe and work your pelvic floor. Now, we're not teaching you how to do that because we all breathe and we all work our pelvic floor every time we inhale. Did you not know that? So when you do a Kegel, it works about 30% of your pelvic floor. When you do a hypopressive, guess what? It works 70% of your pelvic floor, and it's a subconscious contraction. So you don't have to think about it. Just sitting here, I've just worked my pelvic floor. Amazing. So we put that together with a hypopressive, which is an abdominal vacuum, which lifts and pulls in that deep abdominal muscles. It moves all the fascia in your body, which is why it's so great for women or men who suffer with IBS. It gets all the scar tissue moving if you've had abdominal surgery. So if you've had a hysterectomy, appendix out, a C-section, it gets all that scar tissue to move, and it will lift the prolapse. While you're holding that hypopressive vacuum, the prolapse is held higher. When you breathe again, obviously everything starts to drop, but the more hypopressives you do, the more everything lifts and stays lifted. So it improves your posture, it improves your core strength, it improves your pelvic floor strength, and 9 times out of 10 it improves your prolapse symptoms. It improves your sleep. We've seen people sleep better, not having to get up for a wee in the night. It improves your lung capacity, and it also is, and this is sort of so important at the moment, it's a great relaxation, stress and anxiety relief. That meditation is all about stopping and breathing, and that's exactly what we're doing. So if you've got any questions, let me know.